Welcome back to EC Nurse, where nursing education made easy, and EC Nurse is presenting Lakshya 3.0, where we are discussing the exam-oriented important topics and questions. So today we are going to discuss second year post BSc nursing from, that is the subject community health nursing that we are going to discuss. So second year post BSc nursing, please attend, and this exam for the community health nursing upcoming exams, you will get the best scores, and I'll explain how to write the exams, what are the types of questions you can expect for the exam. So first we will see about the community health nursing question model question paper. So the question will be 3 hours. You will get the 3 hours. So you'll get 3 hours to write the exam. So maximum is 3 hours to write the exam with 75 marks. You need to write for 75 marks questions, and that will be 3 hours. So that is community health nursing question paper pattern. So the question paper pattern, you will have to write 2 long essays. So first you need to write about long essays. That is 2 long essays you will write and you will get 20 marks for the long essay. So describe example, we are going to see some of the patterns of question paper that you have previously asked. So describe the organization and administration of health services at center, state level in India. Define primary health care. List the elements and explain the principles of primary health care. Define epidemiology. Explain the scope and application in community health nursing. So these are the pattern of questions you can expect for the long essay question. You need to write 2 long essays. So maximum you take 15 minutes to write the long essay, then another 15 minutes to write the next long essay. Try to finish within the time, because you only have 3 hours to write the exam. So next you need to write the second category, that will be short essays, and you need to write 7 short essays, and each will carry 35 marks. So you need to write 7 and 7 short essays should be written, and it carries 35 marks. You will get 35 marks from the short essay. Example questions are promotion of health, role of community health nursing in MCH services, concept and scope of health education, types of occupational hazards, direct modes of disease transmission, functions of Director General of Health Services, explain the causes of maternal mortality, Indian Red Cross Society, methods of presenting data. So these are the types of questions or the example for short essay questions. Now coming to the next category of questions, you need to attend and you need to write, that is short answers. So you need to write 10 short answers and each carry 2 marks. So you get 20 marks from the short answer. So you need to write all the questions of the short answer. 10 questions you need to attend, each carrying 2 marks, and you will get 20 marks for that. So examples include comprehensive primary health care, growth chart, example of social mobilization, what is census, need for MLHP, advantage of IUDs, role of ANM in mother and child tracking system, Central Council of Health, expand PMJY, aims of occupational health program. So these are types of questions you can expect in the short answer questions. Now we are going to discuss one by one the long essays that we have seen here. So first question is discuss the organization and administration of health services at center and the state level in India. So health services in India are organized in administrative level at 2 main levels, that is central, national or state levels. So central, the central government will be monitoring, and the state government will monitor in the state level. To ensure efficient planning, implementation and supervision of health programs across the country. So they'll conduct all the planning, implementation and supervision of all health programs throughout the country. So that's why we need health services. So at the organizational level, the central government is mainly responsible for formulating national health policies. So national health policies is formed by the central government, providing funds, technical guidance and coordination with international agencies. So that is organization at central level. So in the central level, Ministry of Health and Family Welfare. So we have Ministry of Health and Family Welfare at the central level. The Ministry of Health and Family Welfare is the main authority of health administration at national level. It has 3 main departments. Department of Health and Family Welfare looks after public health, hospitals, family welfare, immunization and disease control programs. Department of Health Research, promoting and coordinating medical research to Indian Council of Medical Research, ICMR. Through ICMR, they are conducting or promoting and coordinating the medical research. Department of Ayush. Ayush is dealing with the Indian system of medicine such as Ayurveda, Yoga, Unani, Siddha and Homeopathy. So that starts Ayush. So these are the 3 main departments in the Ministry of Health and Family Welfare. So next, under major central health organization, Director General of Health Services (DGHS) provide technical advice to central and state government. So this the Director General of Health Services is giving the technical advice to state as well as the central government. Central Council of Health and Family Welfare advises both levels of government on policy matters. Central Government Health Scheme provides health care to central government employees. National Health Mission implement the programs like NRHM and NUHM. ICMR conducting the biomedical research. AIMS, NIMHANS and JIPMER that providing tertiary level medication, education and care. So AIMS and NIMHANS. So NIMHANS National Institute of Mental Health and Neuroscience. So now we will see organization at the state level. So coming to state level, at the state level, the state government is responsible for implementing the health program, managing hospitals and public health activities. So state health ministry headed by the Minister of Health and Family Welfare. So the Minister of Health will be headed by the state health ministry. Welfare assisted by a secretary will be there. Director of Health Services, Director of Medical Education. So what are the structures? State directorates implement national and state health program. District level, there will be chief medical officer or district health officer that supervises the health services. At the block level, there will be that is medical officer in charge and manages community health centers. Peripheral level, primary health center and sub-centers that deliver primary care. So these are the structures. Coming to the coordination between center and state government, the central government provide policies, guidelines and financial support. The state government execute and monitors programs through health workers and institutions. So one is part of the planning, other one will be executing. And next question we are going to discuss, the second long essay we are going to discuss. So while writing a long essay for a 10-mark question, you need to write maximum points and you need to fill up the pages. So the question paper in some university papers, already the question number will be marked in the answer sheet. So complete the first question with completing to the next question. To till that you need to write. The next is define primary health care, list the elements and explain the principles of primary health care. So according to WHO 1978 Alma Ata Conference, primary health care is essential health care made universally accessible to individuals and families in the community by means acceptable to them through their full participation and at a cost of community and country can afford. So it's a primary health care is an essential health care made to all, universally accessible to each individual. So every individual need to be accessible to that and the families in the community by the means to acceptable to them through their full participation and at a cost to that community and country can afford. So that is what called primary health care. So what are the elements of primary health care? There are 8 elements. First, health education on prevailing health problems and prevention. Promotion of food supply and proper nutrition. Adequate supply of safe water and basic sanitation. Maternal and child health care including family planning, immunization against major infectious diseases, prevention and control of locally endemic diseases, appropriate treatment of common diseases and injuries, provision of essential drugs. So these are the elements of primary health care. Now we will discuss about the principles of primary health care. It is equitable distribution. Health services should be available to all, especially the underdeserved and rural population. So the services what we are providing or rendering through the PHC, it should be an equitable distribution. It should be equally available for everyone in the society. Community participation. People should be involved in the planning, organization and implementation of the health program. Intersectorial coordination. Collaboration between health and other sectors such as agriculture, education, housing and public works. So work with the other sectors, that is intersectorial coordination. Appropriate technology. Use the scientifically sound, adaptable and affordable methods. Example, oral rehydration solution, mosquito net. Focus on prevention. Emphasis on preventing disease rather than only treating them. Referral system. Patient should be referred to higher centers when necessary. Sub-centers, PHC, CHC, district hospital. Sustainability, that is services should be cost effective and self-reliant using local resources. So these are the principles of primary health care. So the third question we are going to discuss is define epidemiology, explain its scope and applications in community health. According to Paul, epidemiology is a study of distribution and determinants of health-related states or events in specified population and application of the study to control the health problems. So it's a study of distribution and determinants of health-related facts or the states or events in a specified population. So in a specified population, we are defining the distribution and determinants of health-related facts and application of the study to control the health problems. So aims of epidemiology to describe the health status of population. We can use epidemiology to identify the cause or risk factors of the disease, to control or prevent the disease and promoting the health. So what is the scope of epidemiology? Descriptive epidemiology studies disease patterns according to time, place and person. So we are going to study the diseases. That is descriptive epidemiology. In that studies are based on the patterns of time, place and person. Analytical epidemiology identify the causes or risk factors. Example, case control and cohort studies. Experimental epidemiology tests preventive and control measures. Example, vaccine trials. Clinical epidemiology applies epidemiological method to clinical practice. Molecular epidemiology studies genetic and molecular factors influencing the disease. Social epidemiology studies social factors affecting the health. So these are the scope of epidemiology. Application of epidemiology in community health. So we need to use that. Why we need to use community health nursing, the uses of epidemiology. Disease surveillance, that is detecting outbreaks early and monitoring the trends. Health planning provides data for designing and evaluating the health program. Disease control helps in implementing prevention and control strategies. Health research identifies risk factors and effectiveness of intervention. Health education promotes awareness about disease prevention, evaluation of services, measures the effectiveness of health services, setting the priorities, helps allocate resources based on the disease burden. So these are the applications of epidemiology in community health. Yes. So now we will see about applications. We have already seen this. Sorry for the trouble. So we will see some of the previous years, some of the questions that you have repeated multiple times in the community health nursing. That is the longest question. So it has multiple times it has repeated for the exam. So we are going to see some of the important long essay questions. Explain the objective and principles of community health nursing. Describe the organization and administration of health services at the center and state in India. List the methods of epidemiology and explain one method in detail. So that question have repeated. Explain the healthcare delivery system in India. That is, we need to study about the central and state government. List the occupational hazards and explain the role of community health nurse in occupational health services. Explain detail regarding community health nursing process. Explain briefly regarding family welfare services. Explain briefly regarding the occupational hazards and role of community health nursing in prevention. Define health education. Explain the principles of health education. What is maternal and child health? Explain the antenatal care in detail. Define epidemiology. Explain descriptive epidemiology in detail. So explain maternal and child health program in detail. Define school health. Explain the components of school health. Write a note on family welfare program. Explain the role of sub-center personnel in family welfare program. Write a brief about community nursing process. List the international voluntary health agencies and explain the role of WHO, World Health Organization, in control of communicable diseases. Define occupational health. Explain the role of community health nursing in occupational services. Define family health services. Explain family as a unit of service and discuss the principle of home visit. Discuss the organization of health administration at state or district level in India. So what are the principles of health education? Explain the methods and media used for giving health education in community area. Define health information system. Explain the methods of presenting the data. Define epidemiology. Explain in detail about the prevention and control of communicable diseases in the community. Write in brief about community health nursing process. So these are the questions that have repeated in multiple times in the long essay. So now we are going to discuss about the short essay question. So the answer any 7. So you need to answer 7 questions and carry 35 marks. So totally 35 marks you need to get from the short essay. So we are going to discuss one by one. First question is promotion of health. What is promotion of health? Help the promotion means enabling the people to increase the control over and improve their health. So we are promoting their health to prevent the disease condition. That is what called health promotion. So what are the objectives? To prevent disease, to promote physical, mental and social well-being, to improve the lifestyle and environment. So that is the objectives. So what are the method of health promotion? Health education, awareness on hygiene, nutrition and exercises. Environment modification, that is safe water, sanitation, population control, nutritional improvement, balanced diet programs, lifestyle changes, avoiding smoking, alcohol and stress, like early detection and screening for hypertension, diabetes and cancer. So these are the methods of health promotion. So what are the levels of health promotion? Individual level, that like personal hygiene, diet modification, lifestyle changes, that are individual level. Coming to the community level, mass campaigns, vaccination drives and immunization programs. That is the example for levels. Next question we are going to discuss is role of community health nursing in MCH services. So what are the role of community health nurses? MCH stands for maternal and child health services, to promote the health of mothers and children to reduce mortality. To promoting the health of mothers and what we are doing here, mothers and children, and reducing the mortality. So what are the role of community health nurse? Antenatal care. So register pregnant woman, monitor BP, weight, anemia and immunization. Intranatal care, assist in safe delivery, maintain asepsis. Postnatal care, educate on breastfeeding, nutrition, family planning. Newborn care, temperature maintenance, cord care, immunization. Under 5 clinics, growth monitoring, vitamin supplementation, health education on hygiene, immunization and spacing. Home visits, identify high risk cases and refer to hospital. So these are the role of community health nursing in MCH services or program. So next question is concept and scope of health education. So what is health education? The process of providing information and motivation to help the people maintain and improve the health. So it is a process we are providing the information and motivating the people to maintain and improve normal health. So what are the principles? Interest and participation, comprehension and feedback, motivation and reinforcement. So what are the aims for health education? To inform people about the health problems, to encourage healthy habits and practices. So what is the scope? Individual and family health education, school health programs, community health campaigns, occupational health and safety training, hospital and clinical settings. So next we are going to discuss about types of occupational hazards. So occupational hazards are conditions in workplace that may cause injury or disease. So what are the types? Physical hazards like noise, vibration, heat, radiation. Chemical hazards, gases, dust, fumes, acid, solvents. Biological hazards, bacteria, virus, fungi. Mechanical hazards, accidents from the machinery or tools. Psychological hazards, stress, tension and monotony. So prevention, proper ventilation, protective equipment, periodic health checkup and safety education. So coming to the next question, direct modes of disease transmission. So first is direct contact, touching, kissing, sexual contact in the case of gonorrhea, HIV, droplet infection, sneezing, coughing, example influenza, tuberculosis, contact with soil, hookworm infection, inoculation into skin or mucosa, bites, injection like example rabies, hepatitis B, transplantal or vertical transmission from mother to fetus in the case of HIV or syphilis. So these are the modes of disease transmission. So next question we are going to discuss is functions of Director General of Health Services. So DGHS is the Chief Technical Advisor to the Government of India on health matters. So it's a person who is a Chief Technical Advisor to the Government of India on health matters. So what are the major functions? Technical advisors to state and central government, supervision of national health programs like tuberculosis, malaria and leprosy, coordination with internal health agencies like WHO, UNICEF, medical education and research guidance, maintenance of central government hospitals and laboratories, epidemic control and emergency medical response. So these are the major functions. Next we are going to discuss about explain the cause of maternal mortality. So maternal mortality means the death of a woman during pregnancy. So death of a woman during pregnancy, childbirth and within the 42 days after delivery. So that is what called maternal mortality. So it's means the death of a woman during pregnant, childbirth or within the 42 days after delivery. So what are the causes? Hemorrhage like postpartum, bleeding, hypertensive disorders, eclampsia, preeclampsia, sepsis, infections after delivery or abortion, obstructed labor due to malpresentation or pelvic disproportion and unsafe abortion. So what are the indirect causes? Anemia, malaria, heart diseases and poor nutrition. So preventive measures include antenatal checkup, skill, birth attendance, emergency obstetric care and family planning. So next question we are going to discuss is Indian Red Cross Society. So founded in 1920, is a voluntary humanitarian organization providing emergency relief and health services. So Indian Red Cross Society is founded in 1920 and it's a voluntary humanitarian organization providing emergency relief and health services. So its motto is serving humanity. So what are the aims of Indian Red Cross Society? It includes to prevent and alleviate the human suffering, to protect the life and health during emergencies. So what are the functions they have? Disaster relief and first aid, blood donation services, health and sanitation programs they have, maternity and child welfare centers, training in the first aid and home nursing, supports to armed forces and refugees. So these are the functions. So what are the methods of presenting data? Presentation of data means organizing collected information for easy understanding. So we are organizing the collected information for the easy understanding. That is what called presenting data. So what are the method? Textual or descriptive method. Data explained in sentence or paragraph. Tubular method. Data arranged in rows and columns. Example, frequency table. Diagrammatic model. Bar diagram, pie chart, histogram, pictograms. And graphical method. Line graph, frequency, polygon and or give. So what are the advantages of presenting the data? Makes the data easy to interrupt, compare and draw the conclusion. So these are the questions. Now we are going to discuss about some of the 5 marks questions that are the short essay questions that have asked for the multiple types for the exam. So accepts of school health services, national health policy, trends in MCH care, principles of health education, surveillance and monitoring, public health registration, explain the principles of home visit, write about the Indian system of medicine, different methods of communication techniques, function of voluntary health agencies, methods of computing vital signs, responsibilities of ASHA, steps in community diagnosis, vitamin and prophylaxis program, role of community nurses in occupational health services, public health legislation, elements of primary health care of sick at home, levels of prevention of disease, role of ASHA workers to in control of communicable disease, health promotion, types of communication, sources of vital statistics, measure for health protection of workers, descriptive epidemiology, care of handicap, approaches of health education, steps of home visiting, explain census, write about concepts of health team, national health policy, contributions of international health agencies, roles and responsibilities of male health workers, aims of health education, explain the types of bar diagram, explain family as a unit of services in community. Recurrent trends in MCH care, public health legislation, roles of community health nurse, types of occupational hazards, functions of voluntary agencies, list the sources of vital statistics and explain it too, role of nurse in care, planning for health education, Indian Red Cross, objectives of family health services, aims, objectives and methods of epidemiology, explain central government health scheme, school health services, training and supervision of healthcare workers, methods of computing statistics, Indian Red Cross, care of physically handicapped, UNESCO, role of nurse in providing health education. So these are the usually asked questions for the short essay. Now we are going to discuss about some short answer questions and you need to write 10 questions and each carry 2 marks. So you'll get total 20 marks from the short answers. So first question is comprehensive primary care, health care. It refers to the complete health care services covering promotive, preventive, curative, rehabilitative and palliative care for all individuals throughout the life. It's focusing on the community participation, equity and universal access to health services. So what is growth chart? Next question is growth chart. So what is growth chart? It's a tool used to record and monitor child's growth. So we are going to use this for the recording and monitoring a child's growth, weight and height over time. It helps in an early detection of malnutrition and assessing the nutritional status of children. So that is what we are using growth chart. So next question is example of social mobilization. So it means bringing people and organization together for a collective action. So we are having a collective social mobilization. We are collectively participating the group into for a collective action. So bringing up people and organization together for collective action. Like example, pulse polio immunization campaign involving health workers, NGOs and media. So next question we are going to discuss is census. So what is census? It's official count of population conducted periodically by the government in India. It's conducted every 10 years to collect the data on population, literacy, housing and occupation. So need for MLHP. So what is the need for MLHP? Strengthening the primary health care and health care, multi-purpose workers. It is health and wellness center. So the strengthen primary health care and services at the health wellness centers. To bridge the gap between community and doctors by providing basic curative and preventive services. Next, we are going to discuss about advantages of IUDs. So, IUDs is intrauterine devices, long-term reversible contraction, safe and highly effective, does not interfere with sexual activity, quick return of fertility after removal. So, role of ANM in mother and child tracking system. So, registers pregnant woman and newborn, updates service data, ANC, PNC and immunization, ensures timely follow-up and reminders, reports health status to higher authorities. So, Central Council of Health, formed under the Constitution of India, Article 263, to coordinate the health policies between the center and state, advises on the National Health Program, medical education and allocation of resources. So, explain PMJY, it stands for Pradhan Mantri Jan Arogya Yojana. It provides free health insurance up to 5 lakhs per family per year for poor and vulnerable population under Ayushman Bharat. So, aims of occupational health program: to promote and maintain workers' health and efficiency, to prevent occupational diseases and accidents, to adapt work to the worker for safety and also well-being. So, what are the functions here? To promote and maintain workers' health and efficiency, to prevent occupational diseases and accidents, to adapt work to the worker for safety and well-being. So, some of the questions that have repeatedly asked for short answers we are going to see about ASHA, define health education, common health problems for school children, vital statistics, antenatal visits, care, surveillance, define health information system, couple protection rate, health team, sub-center for functions of WHO, training of MLHP, multi-level health workers like community health center, beneficiaries of PMJY in urban, perinatal mortality rate, objectives of RBSK, flip chart. So these are the usual questions that have asked for the exams previously. And health insurance, under 5 clinic, World Bank, activities in health and wellness center, promotion of health, benefits of Ayushman Bharat card, expand MLHP, define the define cases and controls, functions of MLHP, central government health scheme, health and wellness center, difference between data and information, medical packages in PMJY, benefits of mother and child tracking system, methods of presenting data, Rashtriya Bala Suraksha Karyakramam, and uses of health information. Primary prevention, define handicap, sickness benefits in ESI Act, define maternal mortality rate, define active surveillance, define first referral unit, uses of folk media, advantages of posters, list any for audiovisual aids, functions of primary health center, community health center, chikungunya, net reproductive rate, steps of social mobilization, registration, diseases covered under PMJY, activities of Red Cross Society, adolescent counseling. Distinguish between data and information, vaccine vial, monitor, importance of family, coping index, define eligible couple, list the maternity benefits of ESI, active immunity, define prevalence, first referral unit, define pandemic, list the 4 functions of UNICEF, Millennium Development Goals, occupational hazards, pandemic and endemic, elements of primary health care, objectives of family health services, Family Planning Association of India, folk media in health education, independence and prevalence, infant mortality rate and pentavalent immunization. Yes, so till now in the section we had discussed about community health nursing, that is from the post BSc subject. It is post BSc second year. So community health nursing, you have 3 hours to write the exam, and you should have 35 marks questions you will get. So you need to write 2 long essay and also 7 short essay you need to write. 7 short essay you need to write, and you need to write 10 short answer questions. So try to answer all the questions, attend all the questions. In some universities already in the question, already in the answer sheet, the numbers will be there. So check the numbers and write the particular answer on that. And also try to answer all the questions. So attend all the questions, try to answer that and complete within 3 hours. So these are the things you need to consider while studying and writing community health nursing. You need to explain about all the things in detail. So explanation is needed for all the topics that you are going to write. Yes. Yes, so still now in the section we had discussed about a model question paper from Community Health Nursing second year post BSc Nursing. I hope everyone understood. So continue learning with Easy Nurse, where nursing education made easy. We will meet in the next section with another interesting topic. Till then, thank you.